Hello and welcome to my YouTube channel, Freedom Speaks. My name is Netsanet Mulugeta, but I do go by Netsy. I'm originally from Ethiopia, so my origin of my name actually means freedom. That's the meaning, and so that's where I got this name from, Freedom Speaks, and so welcome. I am a pediatric practitioner. I have been in this field, in the medical field, for almost 15 years now, but currently in the past 3 to 4 years I've been specializing in integrative medicine. And currently I'm actually in my doctorate program, and I am focusing on autism studies and looking at the underlying medical conditions that are actually related to autism and how these underlying issues can cause outward behaviors. And I'll be talking about that more in other videos, but today I really want to come here, especially with Autism Awareness Month. I really want to share our journey with you guys and what we went through with my son Joshua. And my son now is in a much better place and such, happy, healthy child. And the reason I waited so many years to even share this journey is, number one, I really wanted my son's consent. I wanted to make sure that I did right by him and that he was okay with us sharing his story, really, our family story. And next, I'll be honest with you, and as an autism parent, a lot of people know, it's very hard, I would say, mentally, spiritually, physically, so many things. And so I don't feel like I was in the right space yet to share our journey. But now it's been a few years, and we're in a much better place, and I feel like I'm ready to share this journey with you guys. My main reason to be here is to give families hope. I know being an autism parent, it can be very lonely. It can be very dark at times because we're not given much hope or many options for our children. But today I am here not as just a practitioner, but truly as a parent, to talk to you guys about our journey and how we were able to help my son and bring him a happy, functional, healthy life. In no way or form am I saying autism is treatable or curable. That is not what I'm saying, but I am saying that there are a lot of underlying medical conditions that are related to autism that can be treated and can help these outward behaviors, whether they are head banging, stimming, nonverbal, a lot of these symptoms that, are related to autism, those things can subside or even get better over time. And so, like I said, welcome. I'm going to get right into talking about my son's journey. So, my son Joshua, at the age of, I would want to say 1.5-ish, 2, up until that age, was healthy. He was our firstborn, super healthy, big boy, breastfed for like the first 2 years, tried to do everything right. And like I said, I'm a pediatric provider, so I've been in this field at that point almost 8 to 10 years. And so I felt like I knew what I was doing. I literally gave this advice on a daily to my patients. And so I was trying to do everything right, even prenatally. And so he was born, he was healthy, he was thriving, he was doing well. But like most families, who have autistic kids, we started seeing red flags. I want to say around the age of between 1 to 2, we started noticing sensory issues. We started noticing that he wasn't really answering to his name. He wasn't turning when we would call him. His eye contact was fleeting. He kind of wanted to play more alone. He had some stereotypical behaviors of like jumping, flapping, few times even some tiptoe walking that we noticed. And I also saw that he had no words. He literally had no words. And so again, as a provider, I saw these signs, I saw these symptoms, but when I went in to get him evaluated, a lot of times I would get, well, you know too much, you're a pediatric provider, you're overthinking it. And then I feel like from my family side, I would get, he's a boy, boys talk late, give it some time. And of course, as a parent, it's easier to hear that your child maybe just a little behind than, he has autism or he has any kind of delays. And so, I took that until about 2. And at the time I was pregnant with my second, so it was a lot going on, a lot going on in our life at that time. And so what happened next was again around 2, I felt like, still no words. And so I pushed our provider, our pediatrician, to an evaluation. And again, I got, no, he's fine. Boys talk late, give it some time. And so I said, okay, can we at least get a speech eval? And we did. We got a speech evaluation, and we started speech therapy for a few months. And again, no progress. I wasn't seeing progress. If anything, I felt like my son was getting worse and worse. And some of the big signs that I didn't mention earlier were he didn't sleep. He was waking up every night, every hour, actually, just like a newborn. So imagine, you as a parent, that newborn phase, those first 2-3 months, it's hell. And imagine living that life for years. My son actually didn't sleep through the night until almost 4 years old. And I'll talk to you about how, we were able to gain that. And so basically he was not sleeping through the night. He also had sensory issues with food. So a lot of his foods had to be pureed. He ate a lot of those squeezy packs and milk, pretty much. Like, he would not eat any solid foods. And this was past 2 years old. He would gag. He would throw up. He would, at one point we thought it was reflux, but it wasn't. We checked for all of that, but it was more sensory. We even have at his first birthday, when we were doing the smash cake, I remember he was just bawling because he was touching the cake and it was just too much sensory. The smell, the touch, he didn't even want to taste it. And most kids like cake, right? So even at that point, we were like, something's a little off, but we went with it. And so fast forward, he's in speech, he's getting speech therapy 2-3 times a week, and we're not seeing progress. And again, I'm like, okay, something is wrong. My kid's closer to 2.5 now. And so I take him in, and again, same, pediatrician is like, I don't think so. And so I remember going to another provider, another pediatrician, who, listened to my concerns, and she was like, yeah, at 2.5, he definitely should have some words. And so I said, can I get a full evaluation, like a full, developmental evaluation? And so they did. We had the psychiatrist, the speech therapist, the full evaluation. I lived in California at the time, and so I also knew about regional center. And so I also, at the same time, simultaneously had him evaluated at regional center and also with our provider. And I honestly did that because I just wanted to make sure, I wanted to have 2 separate evaluations. And when we got that evaluation back, not only did it come back with severe autism, it also, one of the evaluations stated that he had ID, which is intellectual disability, and that is because he was below the first percentile, IQ-wise, because he was nonverbal, he wasn't able to really answer or even point to the questions, or even able to, there's different things of building blocks or appropriate play with dolls, and he was not able to do any of those things. And so when we got that evaluation back, I'll be honest, because I felt like, especially as a mother, when something is wrong, I was actually relieved, because I was like, finally, somebody sees what I see. Somebody sees what's going on. And one part of this story I forgot to mention is right before our evaluation, I actually had put him in a preschool. And I remember, being told, it's because he's not around other children. Maybe if you put him in preschool, he'll start talking, he'll start playing with other kids. But what I noticed is that every time we would pick him up, he was playing by himself, doing his own thing in his own world. And I remember about 2-3 weeks into it, the teacher took me aside and said, hey, have you got his hearing checked? And I remember saying, why? What's the reason? And she's like, well, I just feel like, he's not, when we call him, he doesn't really answer. And so for me, that was another clue where I said, okay, someone else is seeing what I see. It's not just me. It's not just dad. Someone else sees it. And I worked at Children's Hospital at the time, and I made sure I took him to the top audiologist, got him checked out, and they're like, his hearing's great. He passed flying colors. So again, I'm like, this is not a hearing issue. This is obviously something else is going on, And many of our kids with autism do not have hearing issues, right? Maybe selective hearing, but not actual hearing issues. And another reason I knew why is because he was obsessed. He had OCD with like water and water play. If he heard water from even upstairs, he would run. But we would call him, he wouldn't answer. But if he heard water, he would come running, and he would literally do this thing called peering, where he would just look at the water and watch it go. Like, and if I didn't stop him, he can be there for an hour, 2 hours. Like he would just play with it, and he was obsessed with water play. And this is very common for children on the spectrum. And so he was, overly focused, overly obsessed on certain things like that, and like lining up toys. And so it wasn't an appropriate play for a 2-year-old. And so, like I said, fast forward, we get his diagnosis, and it shows that he has severe autism and also intellectual disability. And as a parent, of course, that's hard to hear, but for me, it was a relief, because I felt like somebody finally saw what I saw. There was an issue. And I'll be honest, I was so, I guess, hopeful. I was very hopeful that, if we put him in all the therapies, I said, okay, what is it that we need to do? We'll do it. And so they said, ABA, which is, the applied behavioral, therapy, speech, OT, feeding therapy, music therapy, everything. And then we also pulled him from his regular preschool and found a special ed school that would integrate, him into even a regular class, and also give him that one-on-one attention that he needed. And so we did that. And again, as most autism parents know, both parents, it's almost impossible. Both parents cannot work and also take your child to therapies and pick them up and take them to school and then come home for ABA therapy. And so, because ABA applied, that behavioral therapy, it's 30 to 40 hours a week. And those are people coming into your home and doing this therapy. And so it was a lot. And so when me and my husband discussed this, we decided, like, I'm in the medical field. I have more, access to care. And so I want to make sure that I'm still working and be able to, have that access for my son. And so we decided my husband would stay with him. And so my husband full time, quit his job and said, I'm going to dedicate everything to our son. And at that point, we had a newborn baby also. So it was a very hectic and overwhelming time for us. But we were ready to do everything to save our son and to help our son, really. And so what we did was we did everything that we were told to do. We did the full-time therapies 2 to 3 times a week. We did ABA therapy about 5 to 7 days a week in our home, and we put him in a special school. Long story short, we did this therapy for about 6+ months, probably 6 to 8 months. And again, no progress, just the way we saw with speech. Very incremental progress. If anything, I feel like during therapies, because he was kind of being forced, there was a lot of tantrums, a lot of crying, and that's another behavior. He would cry for hours sometimes, and we wouldn't know why. And it's so hard. And especially for me, I felt like he was in pain. I felt like, he would moan, sometimes he would hold his tummy, and I'm just like, what's going on? And when I would take him to our providers, I would say, hey, can we get a workup? Like, it looks like his tummy's hurting. And, I would get, that's just autism, or if you want something to calm him down, here's a psychiatric medication. And I didn't want to do that because I truly felt like something was going on in my son. But I didn't know what, because he didn't have the words to tell me how he was feeling at the time. And so, like I said, about 6 to 8 months went into this therapy. We're doing everything. And I will tell you, getting his diagnosis wasn't the hardest part for me. I think it was 6 to 8 months going into this and realizing, like, I'm doing everything that I'm supposed to do, and my son's getting worse. He's not getting any better. And so, sorry, I get emotional sometimes, but so he's getting worse, and that's where I feel like I was starting to be losing hope, feeling heartbroken. Where do I go from here? And I remember one day, and I'm a believer, so I feel like God woke me up one night and was like, do your own research, do your own research. And I woke up, I remember at like 2 or 3 in the morning, and I just was, going all over the internet, scouring the internet, looking for anything I can find. And I happened to cross a website called TACA, T-A-C-A. And they are basically an organization that talk about the underlying issues that can be related to autism. And by treating those, underlying issues, how our kids get better. And so I read so many things about gluten-free and dairy-free, and, and I even, I'm a nerd. So I was looking at PubMed articles. I was trying to find and correlate, and I just found so much that made sense. And it just happened to work out. I was living in Southern California at the time, and they are based out of that area. And so they were actually having a 3-day conference where it was like international and all of these different, the field is called biomedical. And so there were biomedical doctors, integrative physicians who came, and they were talking about, how gut health, how underlying GI issues can, manifest in behaviors, how mitochondrial issues can cause cognitive delays and focus issues, how nutritional deficiencies, because think about it, like our kids eat at maximum, a lot of our kids maybe eat 2 to 3 foods. They're such picky eaters. And like I said, my kid at that time was definitely not getting enough nutrients because he was eating just soft pureed foods, and even that was limited because half the stuff he would throw up because of sensory and smell. And again, I remember before even going to TACA, I asked my provider, like, please, can you order some labs? And it was like, why? And I was like, well, my kid's a picky eater. He's not eating anything. What can I do for him? And I was told feeding therapy. And I'm like, we're in feeding therapy. But while we're doing feeding therapy, shouldn't we check his vitamin D and his iron and his, his thyroid and just make sure everything is functional, because he has such a limited diet. And so what happened, again, I got pushback. And I always think, like, if I got pushback and I'm a provider and I'm trying to convince, my colleagues, my other providers to do these labs, but it's like, no, because I think, and I will say this, is that I think one of the biggest disservices to autism is that it is classified as a psychiatric diagnosis and not a medical diagnosis. So our children do not get the full medical workup that they deserve. And so a lot of times when we go in and we ask our doctors and say, hey, my kid seems like they have some issues with their gut, or my kid has, only eats 2 or 3 foods, we are given the option to go to therapy. Or we're given a lot of times psychiatric meds to help calm those behaviors because it's seen as a psychiatric diagnosis. And so our kids usually don't get a full, blood work or go to GI or seen by ENT, which they should. And I'll explain to you why in a little bit. And so moving forward, I went to this conference and I learned so much at this conference, and I learned about all the underlying issues, medical conditions that are related to autism. And as I dove deeper, I found so many facts. I found up to 91% of kids with autism have GI issues, gastrointestinal issues, and many of them go untreated. About a third, about 38% of our kids have seizure activities. Again, a lot of our kids are not getting EEGs or a full workup. About 7 out of 10 kids, so 70% of kids have feeding disorders or feeding issues. So feeding issues usually are going to contribute to nutritional deficiencies, but our kids are not getting a full blood work or full, blood panel or workup. A lot of times, like I said, we go in with these concerns as parents and we are kind of shunned away and told, well, that's just autism, or here, go to your therapist and get therapy for that, instead of blood work, instead of a stool test, instead of an EEG or an MRI to look for those abnormalities. But with my background, especially since I'm a medical or a pediatric provider, I knew that these things make sense, and the PubMed and the evidence-based articles are out there. And why I can confidently say that now is because, like I said, I'm in my doctorate program, and that is my focus of study. And what I'm seeing is the research is out there. There's about 10, 15 years worth of research showing that these underlying medical issues contribute to a lot of these outward behaviors. But as we know, or maybe you don't know, a lot of times it takes about 10 to 15 years before autism research turns into actual clinical practice. And I always say this to my patients is we don't have 10 to 15 years to wait until everybody else is on board. We have to implement some of these things in real time, especially if we're finding articles and research that are peer reviewed and that are evidence-based that say that there's something that we can do for our children, we need to do it. And so with that being said, I learned so much at TACA conference, and I came home and I told my husband, we need to start gluten-free, dairy-free. And he looked at me like, what? Why? And I'm like, because these are very inflammatory foods. They can cause leaky gut, which also leads to, inflammation in the brain. And I had read all this research, and I just came back and said, we have to try it. And, at that time, I didn't even realize there was testing or anything else you can do, but I just had learned so much. And I said, it's just food. Our kid only eats 2 to 3 foods anyways. Why not try a low inflammatory diet? Let's see. And so we switched his diet. And I remember the first week that we took out dairy from his diet, my son got his eye contact back. I remember we started calling him, and he started turning to his name. And so we knew we were onto something. Like I said, we'd been working on these things for a year with therapists and 40, 50 hours a week and nothing. And then for us to just change his, take out dairy, and at that point, his eye contact is coming back. His bowel movement started to actually regulate. And so about 2-3 weeks in, we actually took out gluten from his diet, and he actually started having some words. And so we knew again at that point, he'd been in speech for over a year, like, this is working. And so me and my husband at that point agreed, we're not going back. Like, we have to go forward, and we have to do everything we can. At one point, I realized I needed to dig deeper. I needed to do more blood work and stool tests. And so that's what we did. And when we did stool tests for my son, and they weren't conventional stool tests, we had to do some of these more integrative or biomedical or functional medicine tests. We found out my son had leaky gut. He had parasites, he had yeast, he had bacteria, and every time we dealt with those underlying issues, my son got better and better and better. And I will be showing you guys little clips of this along the way of like when we treated the parasites. I remember my son, all of a sudden, I remember he read the book Brown Bear, Brown Bear. We didn't even know my son could read at that point. As we treated the underlying medical conditions, my son got better and better. Did it happen overnight? No. It took us almost 3 years. So we started this journey closer to like 3, and about 5.5 to 6 is when I can say my son truly got, better and had that health recovery. And I'm glad to say, I'm blessed to say that, it took us almost 3 years to get to where we are, but my son now is fully verbal. And when he was first diagnosed, I was told that he probably would never talk, that he would be diapered for life. And he was diapered past 4 years old, so he was diapered quite a long time. That, most likely he would end up institutionalized because of how severe he was at the time. And those were very hard things to hear. And I'm not saying that I didn't accept the diagnosis, or I was saying that, no, my son doesn't have autism. That's not what it is. But like I told you, I felt like my son was in pain. And every time I took him in, nobody was willing to do the full workup for him. And my son was told that he was in the first percentile and diagnosed with even intellectual disability. And just this year, he's 8 years old now, but this year he was tested, and I was told that he actually tested above the 100th percentile and that he's gifted. And so I'm here today to tell you that there are underlying issues that we can treat for our children that will produce, that will help reduce some of those outward behaviors. Did it happen overnight for us? No, it took us a while. Was it easy? No. There was a lot of 2-3 steps forward, 1 step back, and then 2-3 steps forward, 1 step back. But we made progress along the way. So I'm here today to give you guys hope, to tell you there is something we can do for our kids, because a lot of times we're told, this is it, this is autism, just accept it. And we're not really given options of how to help our children. And what really drove me to get into this field and to help children on the spectrum is because I remember one of the first things I asked my son when he was fully verbal and he started talking is, I said, Joshua, why were you waking up every night? What was it? Because it was almost 4 years it took us before he started sleeping through the night. And he said, Mommy, my tummy was hurting. And I still get emotional about that, because I feel like my son didn't have those words for 4 years to tell me that his tummy was hurting, But when we dealt with the yeast and the bacteria and the parasites and all of these things, he got better. He started sleeping better. When we checked and found out he had so many nutritional deficiencies, he had iron deficiency, vitamin D deficient, and all of these are linked to lack of quality of sleep. his sleep got better when we dealt with the nutritional deficiencies, and we dealt with his gut issues, because then he wasn't in pain anymore. He wasn't having all that, reflux or acid or leaky gut. I mean, all these markers came back positive. And so that's when I realized at that point that I can't just go back to practicing medicine the way I was. I need to change things. I need to figure out how to help these children and these families. I came together with some like-minded providers, and we actually opened up a clinic called Lighthouse Complex Care. And I'll definitely go into that in another video in more detail about what we do and how we do and why we do it. We've been able to see patients in all 50 states, and I see patients even internationally. I have patients in Europe, in Africa, all over the world, Canada, and it's amazing how much we've been able to help patients. But really, truly, what we focus on is looking at the underlying conditions related to autism. A lot of researchers are starting to find there's so many connections, like I said, GI issues, nutritional deficiencies, food sensitivities and allergies, mitochondrial dysfunction, immune system dysfunction, infections. There's a lot of my patients who have PANS and PANDAS that we deal with have a multi-system or a multidisciplinary approach of treating our kids, because I truly believe every single child with autism or a complex health issue deserves a full medical workup. And so I am here today, to share our journey, but also, and to give you, really, I'm here to give you guys hope, to tell you that there is something we can do for our kids. We don't have to accept that it's only therapy or only psychiatric medications. We are integrative medicine, which basically means we integrate both. I definitely believe Western and mainstream medicine, there is a place for that. Some of our kids need a sleep study, need an MRI, need an EEG, need blood work. But some of our kids also have other underlying issues that maybe mainstream or Western medicine doesn't always look into. So that's where we do further and adjunct other, therapies and herbals and naturals to try to bring health. And what I believe is when you bring both worlds together, not just mainstream, not just, functional, when you bring both of those worlds together is when I feel like we see true healing for our patients, for our children. And that's what I've seen from my child. Now, practicing for the past 3 years, I have hundreds of patients who have told me, Netsy, my kid is talking now. My kid now is potty trained. My kid is eating. They used to eat 2-3 foods. Now they have a variety diet. My kid is playing with his siblings or playing with other kids. And I'll be honest with you guys, when I hear those things, I feel like my son is, healing all over again or recovering all over again. And that's what I want for every single patient. And I know so many of us feel so lonely in this journey, but I want to tell you that I'm here for you. And I want to hold your hand through this, and I will be, sharing information about all the things we've done for my son, going down to, the diet, all the different supplements, even the medical interventions that we went through. And as I'm also in my doctorate program, I'm going to be bringing, all these articles, all these evidence-based articles that I'm finding, and show you guys what the latest and cutting edge research is saying about autism and how we can help our children. So welcome to my channel. I'm super excited to have you guys here. This is going to be a place of healing, a place where we can share information with each other, and honestly a place where I feel like families with autism are not going to be told that this is just autism and accept it. I understand accepting the diagnosis, but we don't always have to accept all the symptoms and the pain and everything that comes with it. There's something that we can do for our children. So one thing I just want to leave you guys with is that our kids can get better. So I want you guys to hold on. I want you guys to have faith, dig deeper, and let's find answers for our kids together. I know this can be a lonely road, but I'm here for you. All of my experiences I went through, I know was not just for me, but was to help others. And so that is why I'm here. Bear with me. This is like my real first platform, social media platform. So just bear with me as I navigate this space. If you like what you've heard so far, please push like, please push subscribe. I would love to have you. We are family here. You guys all have a great day. Be blessed. Bye. So one thing I forgot to mention is this page, because I am originally from Ethiopia, so I will be having a lot of YouTube videos that will both be in English, and I will be also recording it in Amharic. So ለአበሻ ወገኖቼ soon በአማርኛ record አደርጋለሁ ለሁሉም ሰው እንዲገባቸው እዚህ ነው ያደኩት so ትንሽ ከኔ ጋር you have to be patient ግን ሁሉም ነገር በአማርኛም translate አደርገዋለሁ so ሌላ ሀገርም ኢትዮጵያም ያላችሁ ለሁሉም ሰው እንዲረዳቸውና also በራሳችን ቋንቋ share ማድረግ እፈልጋለሁ so just want to let you know I will be doing usually 2 videos, one in English and one in Amharic. All right, thank you. Don't forget to like and subscribe. Bye.